So each woman's experience as a new and expecting mother is different. For some, the changes during pregnancy and having a baby may come easily. For others, there may be physical and mental health struggles. So, joining me this morning to discuss the importance of maternal mental health are my guests, Mr. Amit Motwani, CEO of Rupani Foundation,
Hello.
and Mahtab Moradi, behavioral therapist. Together, we are going to learn about Rupani Foundation's maternal mental health initiatives. And Mahtab is going to guide us and navigate us towards care for pregnant women and, after birth as well. So let's just dive right in. I'm not going to do any introductions because we've had them on our show before, and the last time we talked about early childhood education and we learned a lot. And the foundation does really great work. And today we are going to talk about maternal mental health, which is so important for all of us, right?
Yeah, thanks so much for having us on today. And I want to start with a couple of things. First, a little bit about Rupani Foundation. I know we met last time, but it's always good to remind folks that our mission is to share best practices in early childhood development so that families can have their best shot at mental, physical, and economic well-being. And of course, early childhood development really encompasses the worlds of prenatal health, postpartum health, all those things, all those zones, if you will, which are epicentral to the health of the child, the health of the mother, and the health of the family. Mm-hmm. The second thing I wanted to mention is that Mahtab is not only a behavioral health expert with decades of experience, she's also
giving away my
that's
age.
A good. Oh God. I've got decades of experience in my world. Well, I just wanted to mention that Mahtab also has our back at Rupani Foundation. She's a board member. She's a board member, and we are very, very honored to have her guidance, irrespective of how much experience she brings.
We're always gonna stay at the 2 decade, like just moving
I didn't
forward.
say I didn't say a number of decades, did I? So now who's aging whom?
Don't flip it on me.
I know, right? We had a good start.
Yeah, so I think that this is one of the reasons I've been so excited about what Rupani Foundation is doing.
Yeah.
Because not only they're addressing mental health, but, I've always been a big, fan of why don't we, stop the problem from ever happening? Why, as a society, are we so reactive in medicine, in mental health? In just about anything we do, we are a very reactive society. And so I got very excited when Mr. Rupani was talking about this initiative and how progressive. And not only did he define prenatal care, not just from the time of conception, but he's like, with these refugee families, it's like the minute they get married, the mother-in-law is hounding them. When's the baby coming? When's the baby coming? So when we talk about the mental health of mothers, it almost starts on your wedding night, right? If you really think about it. And of course, my background as a clinician, I have had a lot of experience when things go really, really bad, when partner relationships are turbulent and suddenly a pregnancy happens. And then there's a fear of God put in that woman where you can't even go tell your OB-GYN what's going on because there's such messy situations at home. So I really want to make it an intention today to normalize talking about those uncomfortable things, and for folks out there to know that there is help, that there is people who understand you, there are people who speak your language who understand you, there are people who live through all of it with, I had one smooth pregnancy and one not so smooth pregnancy. So I'm very transparent about my life experience because I think part of the problem in the healthcare system is that there's this, gap between the human story and the help that's available. And somewhere people at very critical points in their life, they get lost in the system. So that's the storyteller in me, because I feel like you have to fully capture the full narrative of a person before you can start labeling them or addressing the kind of the biology or mental health component.
Yeah, we need to understand it. Like, what is maternal mental health? We don't even know. Sometimes when we are going through it, we are so confused, right? We just think it's us, and maybe it will go away. It's just a bad day, and tomorrow is a new day, so nothing will, things will change. So all of these things, and there are so many things that goes on in our minds at that time. It's so confusing.
Yeah, so one of the things that I run into is that we almost normalize anything that could go wrong, and we make an excuse not to ask for help.
Yes.
Because people say, well, it's just hormones.
But I feel like as women, we tend to just shrug it under the rug, that it's okay, you know what, like, I'm going to take care of me later, let me take care of everything else first. And that's where I feel like we do ourselves injustice.
Yeah, because, I mean, the minute you sign up to be someone's mom, you owe it to them to be at your best, because their livelihood depends on where you are with yourself, right? I mean, even, the amygdala is the emotional regulation part of our brain, right? If you're not happy, if the mom is not happy and they're anxious, the let go response, which is a function of breastfeeding, it shuts down. That's why some women have a difficult time nursing. So, I mean, these are just very, it's common knowledge, but it's the person, are you encouraged to look for it? Do you have a fear of asking for help? What is the culture of your family environment? What is the culture of your relationship? Now it's best practice when the minute you find out you're pregnant, you go to your OB-GYN, and at various points of your pregnancy, they do suicidal, intakes, like if you're having issues with mood, how much anxiety you're experiencing, because typically we hear, postpartum depression. Well, I didn't have postpartum depression. Mine was diagnosed as postpartum panic disorder. And I remember the day I actually first experienced it, and all my family, they have some sort of, we have like a cardiologist on call because as a family, we have so many heart issues. I'm like, oh my God, it's my turn. I must be having a heart issue in the middle of a pregnancy. Great. Whoa. And I went to work, because I worked literally till the day I gave birth. And lucky for me, I'm a chatterbox. I tell everybody what's wrong with me. So I worked with 12 other clinicians. We took these long lunch breaks, which I always tell them, you guys are the reason I'm not medicated. Because I was like surrounded by the best of the best, and they're like taking care of me like so well. Even to this day, when I get stuck, I'm like, I know who gets off at what time with their various mental health roles, and I'm like, all right, I like Houston traffic. I'm going to put you on speaker, and you're going to be my therapist for the next 90 minutes.
It's the best kind of medicine.
But I return the favor. It's not a one-way thing. So, but what I was trying to say is sometimes, that's one of the misinformations.
Yes.
It's not going to look like depression. It's not going to be, your hormones, you can't get out of bed. Sometimes you're going through something, you got plenty of energy. In fact, enough energy to have another child and hold a 60-hour gig. I had a job, I had a private practice. I was go, go, go. There's nothing that looked like clinical depression on me. But there were so many things that were going through my mind that was hindering me. And I would have these episodic like panic attacks to the point where I couldn't breathe. And I was like in Pilates, in yoga, working out 6 days a week. So none of these things could explain what I was going through. And And that's when I started doing the research on, wait, I can't be the only one. You know, everyone, I mean, millions of women have had babies for thousands of years. Like, what's going on? So then I got curious, and when I get curious, I start asking people who've been through something and kind of try to gain something from their wisdom.
Yeah.
And then I kind of put it side to side with my own knowledge, and I weigh things out. So I think that needs to be normalized. The fact that at every point in a woman's pregnancy, or even the idea of getting pregnant, maybe you have you know, you just got married and your family's like, well, you know, your time is ticking. Don't you need, something needs to happen here? Well, why don't you look at the overall baseline, what I call a baseline of your mental health? When I say baseline, I mean, if your entire life, let's say you've struggled with rapid cycling bipolar disorder, at some point somebody should have a heart-to-heart conversation that maybe motherhood is not for you in the traditional sense, right? Unless you're married to a Hollywood star like Catherine Jones, and you can have 3 nannies around the clock, and you just kind of have this thing, and then the world around you takes care of it, which most of us don't. So let's get real, right?
Of course.
Were you like me? Did you have the genetic loading or disposition for anxiety to begin with before you ever thought about a pregnancy? Chances are you introduce hormones, you introduce all these variables of pregnancy that are not in your control. So it would make sense for those symptoms to be heightened during that time, right? So baseline, where was I before? Was I having the right conversations? What was my game plan to keep these things at bay, right?
Yeah.
So that's kind of the pre, you know, the pre and the post picture. From what I see in the data, it says once a woman gets pregnant, it's like this switch goes on. So you are going to be at a different kind of regulation mode that whole entire time. Even if you have a miscarriage, apparently, even if you have a miscarriage, it takes time for your brain to turn the switch off. Okay, guys, we don't need to make a baby anymore. We're done here. And then you have these like dives and the not so good feelings. And not just the sadness of grieving a baby, but a little bit more exaggerated.
Yeah.
So in that time, I don't care what religion you are, what your spouse thinks, my gosh, get 10 milligrams of an SSRI. I mean, it's not a permanent thing.
Yeah.
Right as you know, when you ride those hormones out at about 18 months, talk to your doctor, wean me off. I'm done with this thing.
Right.
So it's kind of those type of questions.
Yeah. So how is the foundation, you know, with maternal mental health? What is the foundation doing?
Yeah,
now?
that's a great question. I think, you know, I could segue into that a little bit by jumping off of the notion that when you're looking, you know, Mahtab, you mentioned that refugee families especially have unique circumstances, whether it's immediately after getting married and what that family structure looks like. And I might suggest that if we even zoom out further, and let's just say not necessarily looking only at refugee families, but all maybe immigrant families, or at least Asian immigrant families, for example, we share a lot of this in common with, you know, whom we're calling maybe refugee families. We have a lot of the same cultural norms, a lot of the same cultural stigmas, a lot of the same in-law challenges, and certainly, I think, in most cases, certainly many cases, we share a lot of the same sort of disproportionate burdens that we put on women in our cultures as well as mothers in our cultures. And so I think, you know, of course, I can't speak on the data, and I'm certainly, as a man in the room, doing my best to sort of speak very speculatively and be clear about it, but it's almost as if the dismissiveness around concerns, oh, it's just hormones, or oh, it's just a thing, you know, it's a phase, it's almost as if that's fueled very much by the men in the culture. Things that we don't understand, we often dismiss. And I think, I think there are plenty of examples of that. I don't need to necessarily jump into them. But, my larger point is that this is all families. And if we zoom out from Asian families, I think we could look at the same kind of questions, which are stigma, whether that's a lack of education, a lack of being informed around mental health disorders and what that means, and a lack of understanding that it's just really the same as a broken leg or a heart condition, that we either need to treat with physical therapy or some sort of therapy or medication or what have you. I think the second is access, whether that means having the financial resources to access care, whether that means our insurance coverage includes, quality behavioral health care, or really if it includes understanding the systems enough. And I think access is a really interesting point of confusion for a lot of us. For example, if somebody were to mention to me rapid cycling bipolar, I might say, whoa, what is that? Or if somebody were to mention to me, yes, your child might have some behavioral health concerns, would like to refer you possibly to a therapist. There's a good one that's covered under your insurance. You can wait 6 weeks for them. They'll do CBT, DBT, and a couple of other abbreviations. And, as a parent, we may be like, what are they talking about? Or someone's like, well, there's a hypnotherapist over here. And you're like, hypnotherapy? Whoa, is that a pendulum? Like, what's going on? And so it's like, how do we decode that stuff? So access is really, really a big nested mess that's also founded, I think, in education. And then finally, it's the workforce. I mean, I think there's a bottleneck. When I mentioned a 6-week wait, that's on a good day if you're waiting for a therapist or an expert. And so the foundation is really looking, Rupani Foundation is really looking to address in those 3 areas around stigma, outreach, and education, how we can help navigate and support access, and, if there are any systemic ways we can support in improving the workforce challenges when it comes to
translation. Mr. Rupani said he's got like 10 different languages, the educational material.
Wow.
So it's exciting. This is going to be a really great
There's so much
year.
thought put into that because, like you said, language. We don't even think about that, right? Usually it's just a couple of languages, but it's amazing because you're like reaching to a vast majority of people. That way.
That's super important. And, in language, again, it brings me back to base one, which is that, and I was thinking about this the other day as we were translating an assessment, a children's trauma assessment into a couple of languages from Afghanistan. And I was thinking, wow, even in English, like, this is tough. Like, I mean, we could translate to other languages all day long. And, of course, that is super important. Like, without that, we don't have that lens. But I feel like we need like a translation course just for what's going on in English, and for those of us who speak English for the first,
going on, then we'll do the language.
It's like, wait, what do all these things mean?
Understand all of those.
And I'm lucky and privileged to have access to the information I need to be able to study and learn those things. I'm privileged to be able to have access to a good therapist. I'm privileged to understand how to navigate my system, even though it's super challenging for me. However, there's so many fundamental ways that we need to really, really be able to address this. And I think that's really why we're blessed to have a board member like Mahtab on board, who not only brings the industry domain expertise, but also the lens of cultural competence, which is required for us to be family-centered and human-centered and with the families whom we're serving.
I'm glad I'm able to do that because again, when you're going through something and people don't understand what your pain is, that's so frustrating. I remember when I was doing my fellowship in UTMB, and because I had a funny last name, anybody who was foreign, and back then we had fax machines. So the referrals would come through this fax, and imagine I just got I passed my board, and I'm so excited. I would dust my little certificates on my wall. I go, now I don't even know like where some of them are, and I get excited every time I get a referral with my name, because that means like somebody needs me, like hey, and I get it, and they are already like my boss had left, and I was working at this off-site clinic because it was the 4Cs clinic, the indigent care. We had like 4 satellite clinics, and it said, couples issues, marital and like other dysfunctions like intimacy and all that, and then it said Spanish speaking only. And I said, are you kidding me? And I had 2 interns who were like supposed to be watching me,
Right.
and I'm supposed to be setting an example. I said, oh no.
Just
This is
because
not
you're the
happening.
cultural one, or what? Like it just turned you up.
Because Moradi,
Yeah, because
I guess Moradi can be Italian,
Yeah.
Spanish.
Yeah.
I don't know, but I'm like, are you kidding me? I felt
Fair
like my
enough.
grandfather was playing a joke on me. So anyway, and this is why I always joke with Amit about his whiteboard, because he doodles and thinks like as he draws. Well, I had one of those. I had one of those in my office. So I literally did a session doing Pictionary.
oh,
Because I didn't want to turn this Hispanic man away. I mean, he admitted to all these very, hefty problems, and coming to get help with his wife. Like, are you kidding me? That's not, that's why I got into this profession, right? So I'm like, okay, I don't know Spanish, but I can draw, and I
Yeah.
can act things out,
Well, that's what the work takes, really, is like, we ain't scared to jump in with some Pictionary if we have to. And that speaks to the dedication of our team. Nilofer, who was here last time, Nilofer
Yes.
Ali, who heads the team, and our fantastic team of frontline, facilitators, navigation specialists. And it really, really makes sense, again, that we have that kind of leadership on our board, too. We'll bring Pictionary to the game if we have to. And that'll be phase 1, and we'll continue to iterate from there. What's next? How do we bring a specialist in or an expert in to take Pictionary to a translation, from a translation to a curriculum, from a curriculum to sessions? And so, yeah, I really actually appreciate that story, because it's not far from likely some experiences our team
Yeah,
has had.
you gotta help people. So part of their issue was, they were a very young couple, and they wanted to have a baby.
Sorry.
Do we need to take a break?
Do we need to take a break? I just see her giving me signs.
Come on.
Okay. Sorry, guys.
Okay, no worries.
All right, so we're going to go a short break, and when we return, we will continue our conversation with Amit Motwani and Mahtab Moradi of Rupani Foundation. Chai Time on 99.5 FM. Welcome back to Chai Time on 99.5 FM. I am in conversation with Mr. Amit Motwani and Mahtab of Rupani Foundation, and the topic of discussion for the day is maternal mental health. So before, I had to rudely cut you off, Mahtab. Let's continue.
Yeah, I thought we had to go on break because you said the F word, fax machines. I don't know, do they bleep that out? or what? Oh, I guess it was a standard break. I'm sorry. No, back to that.
We had to go on break to kind of control her.
You
Control
can't
the word.
say that anymore.
No fax machine.
What's a fax machine?
Ow, stop it.
And then Sasha mentions about Google Translation, and we are like, Sasha.
Okay, it was like back in 98. I was still in high school then.
I love it. Hey, you earn it.
Anyways, let's continue.
Okay, so I'm going to be the serious one now. I know that, when Amit was talking about like CBT, DBT, these are all kind of terminologies of best practices. Like, for example, cognitive behavioral therapy helps a patient to navigate around problematic thinking errors that maybe hinder them in their progress, or maybe they don't ask for help, maybe because of a cultural narrative, a family script, like asking help is a weakness, or what do you mean? You know, our ancestors, everyone before you became a mom, they didn't need all this. Why are you so dramatic? Why are you, you know?
Yeah.
So it's important to, I think, have a space for everyone to actually talk about, you know, it's not just this problem that I'm living with, or waking up anxious or depressed or unmotivated or having anxiety attacks about how I'm going to be as a mom to this new baby, or what if I get pregnant, I lose the baby, and these people are going to be running after me saying I tricked their son into marriage because they expected a baby first year. You know, there's all these things that go into this picture, and then to also, like, you have to put yourself first. That is your body. You are taking the risk. So one thing that I really want to highlight, besides, you know, I know I get goofy sometimes, but before ever thinking about pregnancy, it's very important that you are aware that physiologically your body needs to be at a place. If you have a body fat that's so low, it's actually harder to conceive. You want to be on prenatal vitamins 6 months prior. You want to pay attention to folic acid. These things prevent a lot of, like, brain disorders that may happen. You want to be more intentional about your lifestyle. You do not want to be drinking and smoking, even smoking hookah. Like, treat your body right. Trust me, our great grandmothers did not pull these things. They were not in Vegas and then come home and get, you know, have a baby. So, like, let's, you know, if you don't know how to cook, maybe you should learn how to cook. Now you have this other life, you know. Maybe you need to make adaptations to your life to get ready, mentally get ready for motherhood, right? So how well you take care of yourself. If you do have a mental health issue prior to pregnancy, you know, a universal benchmark for mental health is 6 months of being clear from any symptom that prevents you from functioning in your daily life. So if your depression, if your anxiety, if your OCD, panic disorder, whatever your label is before pregnancy, if it was not managed, it probably is not a good idea to introduce this new life and put yourself on a hormonal roller coaster.
Well, you know, that makes me think, for example, if I were to say be an individual who has high blood pressure, would it also probably be a good thing for me to get something like that under control and feel like I have that symptomology managed and regulated for a good period of 6 months before entering parenthood? Yeah, and so it's the same, you know, and I think we often lose sight of equating mental health and physical health in the same ways, especially when we're looking at life-changing events or diabetes or what have you.
No, that's a great point. I think people, if we learn to speak of it in those terms, I'm well managing, right? And then there's also the measure of relationship health, right? That's I don't know, maybe my mom says I take motherhood too seriously compared to some folks, but I'm like, it is the most important thing, I think.
Yeah,
right?
I agree.
I build my whole life and my schedule around my kiddos. And even before, I never smoked a cigarette until, well, I still haven't smoked one. Maybe I need to get to it. No, I'm just kidding. But I actually was very intentional about how I treated my body, knowing that one day I want to be in that position to have a healthy pregnancy. And I was very open to my OB-GYN about my anxiety. I'm like, I come from a line of anxious people, and then I've got, you know, heart disease and diabetes. So she kept me in check. She yelled at me. I had this grumpy French OB-GYN, Dr. Vandel. I love her to death. I like people who are smart, even if they're going to be a little grumpy. I'll live with that. But she yelled at me after Thanksgiving for gaining like 2 pounds. And I was pregnant. And I'm like, oh my God, in my culture, I would be praised. But thank you, because I have diabetes in my family. I've got heart disease. So I appreciate you calling me out. And it won't happen again.
Yeah, well, that makes me think, actually, we speak a lot about, I guess, in the industry or in the arena, about integrated behavioral health. And, my understanding of that is that that's really looking at mental health as a component of overall health, really looking at mental health and physical health together, especially in our care system. So what are some points that, I think we have a long way to go before this IBH practice is sort of standardized. But what are some points that in a good system we might look forward to, where our traditional primary care doctors or physicians, or maybe our OBGYNs, might stop and say, hey, let's make sure we have this assessment, or let's make sure, what are some bright lines for us? Because I think a lot of us, we may think, wow, I'm just down, I need mental health support. Where do I start? If I talk to my, a lot of us it may not occur to us that we should ask our primary care doctor. I'll go, the stethoscope is here, and I can mention, by the way, I'm kind of stressed out and I might be depressed. And they can say, we actually have an assessment for that, and then I can tell you what to do next. I mean, where are the points that you think that we need to be ready for, so we could maybe look for help or find like these branches into care?
So I think a lot of women actually find out they're pregnant much later. And there's also, being Persian, it's really wrong to announce a pregnancy until 3 months. And I'm like, oh my gosh, okay, that's a new one, right? I grew up here, so even within when we actually report, so you may not have an OB-GYN from the get-go. So you gotta have a relationship with your PCP or primary care physician, so that you can have that conversation where you're like, I don't know, this is not my baseline. I'm sleeping in, I'm grumpy, my friends call me to go to yoga, I'm turning them down, that's not me. Or I'm agitated. Irritability is like a key indication of depression. People say, oh, anger management. I'm like, no, that's untreated depression. We're scripted, men are scripted to show irritability through anger because it's more powerful, it's more masculine. But if your guy is constantly irritable, he can do really well on a good SSRI. He'll be the sweet guy you knew when you first met him. So we have to break down all these walls. And for a good primary care office would have access to the Beck depression inventory, Beck anxiety inventory, little short symptomatic checklist. Another gatekeeper is the sleep. How are you regulating sleep? If you maybe had a mood disorder before getting pregnant, and maybe rapid cycling or whatever, insomnia is the first alarm. Insomnia and not being able to stop, and pressured speech. There's a lot of components where you kind of have mental health just doesn't come at you like one morning. It has a lot of warnings. And I can't say enough about relationship health. This is something people don't talk about. It's the scariest thing. Imagine, the most vulnerable thing is to say to somebody, I love you and I want to put everything in my life. This is, all bets are on you. And then, in our cultures, to take the risk of making another human. For some of us, we're lucky we live on this side of the world. But I'm divorced. I'm a single mom. I have 2 kids. For me, in other countries, it would be game over.
Yeah.
Right?
Yeah.
Imagine how different our lens is, and how important that relationship assessment is. How important it is. It's not that you're being high maintenance to want the father of your baby to go to a silly appointment and they hear the heart or take blood or check your sugar levels. It's more than that. it's what did I sign up for? Or this one I hate. Well, it hasn't hit me because the baby lives in her. I'm like,
Oh.
We're,
Well, let me
we can,
hit
we,
you.
we
I'm
can,
just
yeah, we can be
kidding.
pretty terrible.
But Mahtab, how do you simplify it for women who, like who have no education or who have like gone through this culture, for generations, right, through their mom and grandmother and all. So how would you talk to them and simplify it, like it for in the foundation itself? Because you all come across a lot of women. So how do you talk to them? Because what we are talking now is probably for majority of the women who's listening is like educated or working moms, but just like for moms who's not educated, who's on the low poverty line, how do you educate them or make them understand all the things that what we are talking about?
So,
Well, yeah, no, go for it. What were you? I've got a lot of thoughts about it, but I also think I should take a back seat because there's a lot I can learn from listening to those of us in the room. So
actually, this is why the way we have approached like the fatherhood groups,
Yeah.
the groups with the focus groups with the mom, when there's an old saying, you don't want to fix what's not broken. If there is a functioning definition of a relationship in the cultural context and it's working, it is unethical of me to go shake things up. You only have to have where you can be helpful and respectful of that boundary of the culture. I can't go in a facility and say, oh my God, he talks to you like that, leave him. Well, you have 5. No, because that's poverty. That's a woman. You got to look at the full picture, right? So what I like to think of is you do very strategic assessment and you almost prep like with Amit going in, because when we thought about the fatherhood groups, the idea of me going by myself was in question.
Yeah.
So one of our strategies was like, we're not even going to call this any kind of mental health anything. We are going to lean into this concept of in every one of these cultures, one thing that we have in common is everybody's about family. Right. So we are going to capitalize on that. And so I needed his help to do, and you can talk more about that. I love that experience.
I could talk all day about the fatherhood groups, which definitely feed into a larger picture notion of how do we meet families sort of where they are, to be able to get the same information we've been talking about here distilled in a way that will be received by them, and so that they may be able to use that again to pursue better outcomes. And I think the number one notion is that the same stuff we're talking about here, that a lot of us who have the blessing of education and opportunity, we can understand, and a lot of us really still don't understand.
Yeah.
It's the same information that we need to be sharing with families we serve who may not yet have had the same access to opportunity. It's the same issues of stigma of like mental health. Oh, I've got a mental health disorder. That doesn't mean you're crazy. That doesn't mean that you're stay away from them. And I feel like we have so much stigma even in the most Western of Western culture around that. That being said, if we're sharing the same information, the number one avenue for exchange of that information is trust. And something that Rupani Foundation, I think, just through intrinsic work of our board chair and founder, Mr. Rupani, who's been leading this kind of work all over the world, but also Neelofer Ali and her team, one thing they've done a really great job of is building trust with the communities we work with. So sharing best practices in early childhood development, sharing resources that families ask for, it shows that we're listening and we can be trusted and we do what we say we're going to do. This has opened up an avenue for us to now be able to share public health information that will be trusted. So we can now start saying these same things. Your mental health disorder is the same as a broken arm, or it's the same as your high blood pressure, and those notions can start to resonate. Then it's the next step. Hey, you've been set up already with the physician through Medicaid. or through a low-cost community clinic provider, maybe you should ask them if they can do one of these simple 9-question assessments for depression, or 7 questions for anxiety. And it's just, do you have this? Do you have this? Do you have trouble sleeping? Or do you sleep too much? It's very simple questions. And if we can share these first steps in a way that are trusted, I feel like we can start to make a difference. And we see that already, and we've done that, again, by meeting families where they are. When we did a focus group for women on mental health, they loved it. They participated. No surprise, Mahtab was leading it. And they also said, we need this for the dudes.
I agree.
So we came back and we brought it for the men, right?
Yeah.
And then Mahtab helped guide. I was like, I don't want to say mental health anything. She was like, well, one thing we all have in common is we all want to be great parents. And so really, really honing in on shared values and trust, I think, helps us do that.
Yeah. No, I know you guys think I offend people all the time, but I'm actually really smooth on that.
We'll ask Amit about
What are your thoughts of it?
Well, I'm not the one who went to break.
Yeah, I think that, when we know better,
Yes.
we tend to do better. I mean, look at us. Well, I'm an immigrant. If something is more fluid, easier, it gives you results, why not? Like, are we hanging our clothes to dry when we have this awesome dryer? Makes everything smell good? Oh, heck no. I'm not going to go back to what my grandmother did. So it is kind of the same thing. And then just this has been my survival all along. Like, have a sense of humor about every angle of life, because it's not always going to be great things happening, awesome, and internalize it and use the resources around you to empower yourself. And speak up when you're not having a good day. Be transparent. Don't emotionally vomit on everybody and put them out of what they need to be doing to be productive. But it's good to normalize that, right?
Yeah, I agree.
Normalizing is a super important part of it, and sometimes I feel like I very over-intentionally do my part to normalize it. There were times, in my past where I would have felt awkward if someone were speaking about their therapist. And now, I wouldn't blink. To me, it's like, oh yeah, okay. So it's like anything else that someone's doing. In fact, when I know that somebody is actually participating in counseling or therapy, I think, oh wow. Especially in the corporate world, I think, oh, okay, here's someone I got to watch out for. But that person has a leg up. That person,
Growth mindset.
that person is growing. And so, that's someone either to watch as a mentor, to be competitive with, or what have you, And I feel the same personally. And so I do my best to try to almost normalize it, because exposure, I believe, is an important conduit to normalizing things.
Yeah.
And to speak about things absent of stigma is to model that stigma isn't there, right? We all kind of have to take that step. And I think bringing it into the mainstream is important. Another thing our board chair and founder, Mr. Nasruddin Rupani, is doing, he chairs a clinic called Ibn Sina, and they are building a huge new mental health center there on their campus, and leading a Muslim mental health initiative, which is something new, I think, especially that all of our cultures can learn from and model from. Again, about bringing mental health into the mainstream, teaching faith leaders what are early interventions, and how can we navigate people? How can we be familiar with these simple assessments that can be given to tell someone, hey, you might have depression? Because faith leaders are hubs. They're very, very important areas of torque. And so I think normalizing is really important. I love hearing everybody talking about it, because it needs to be talked about more.
Yeah.
And my big thing is, it's okay to have a problem. It's not okay to do nothing about it. And this is what I tell my kids all the time. I'll hear you out, but I do not believe in learned helplessness when you've got resources, when you've got possible solutions. So that's why I kind of left the therapy world and I do the mindset, because I'm like, we are kind of, as a society, we are ill in the ways we think. we create problems.
So true.
So I'm like, let me go work on that side for a couple of decades. And mess with some people. No, I'm just kidding.
Yeah.
It's true. We have choices, right?
Oh, yeah.
Whenever we say, "Oh, we don't have an option," or "We don't have choices," no. In everything that you do, you have a choice.
Yes.
You make. That
I do it
choice.
scared. I go to work scared. I go to work anxious, rejected, all of the above. Unless I feel like I'm gonna give someone COVID or a disease, I will still show up for what I need to do. I think that's really important. Just like if you've got hypertension, you take your blood pressure medication, and you still go to work. In fact, a lot of our cardiologists have hypertension, right? Like, talk about modeling. I'm still gonna go do what I need to do.
Yeah.
But
Yeah.
I take my meds, right?
Yeah. You take care of yourself, and you take care of others.
Yeah.
Yeah.
And I always say, especially my first client, I'm like, I need to be transparent. If I'm off my game, this is a matter I may be preoccupied with.
Yeah.
And I appreciate you being forgiving and being flexible. If we're 20 minutes into it and you're just not getting anything out of me, let's reschedule. If I feel like I can't put my best in there, I'll reschedule.
Yeah. Wow, the time has gone by so fast. I hope we covered most of the things we wanted to talk about. But before we wrap up, anything else we should cover?
I just really appreciate you all giving the importance and airtime, literally, to the subject that needs to be normalized most, I think, in our arena. And so, I mentioned the Muslim Mental Health Initiative that Ibn Sina was putting on. You all can look forward to them also putting on an interfaith mental health conference later toward the end of the year. And I think that's something Rupani Foundation will be participating in. Anybody who's here, who's listening right now, anyone, of course, in the room, should let us know if y'all are interested in participating in that. And other than that, just thank you. Thank you so much. Mahtab.
I love words. And I don't know, when you said that, it made me think of a quote. And it goes something like, if you want to show your children you love them, love their mother.
Beautiful.
That's my...
Yay! Thank you. Thank you so much for taking the time out and joining us this morning. It was a really great conversation and an important one to talk about.
Thank you.
We really appreciate it.
Thank you. Thank you, listeners, for tuning into Chai Time. Don't forget the clothing drive this Saturday at Arling's. Drop off your clothes and support Daya Houston. Signing off, Chai Time 99.5 FM.